Dr. Gyandas is a very courageous physician, very courageous. He never bother for any service, rather he love and enjoy the practice as well as he believe his own work, hard work. I am very much impressed by his quality of hard working. And another man is in my life is Dr. Gaurang Gaikwad. I have seen Dr. Rajan Shankaran also a very hard worker man. I have got opportunity to stay with him, and during the stay I found his working capacity, learning capacity, hard working, hard studies. Similarly, I found in the Dr. Gyandas, and suddenly I don't know why he is going to left the service of government service and take care fully of his practice. A very courageous physician, I can say, I can claim also. Now, I request Dr. Gyandas Vani to please discuss his opinion, prescribing, and cases with a please with indication and, if possible, comparison. Academy of Quest, welcome to the under the banner of Academy of Quest as a voice of Quest. Please, Dr. Gyandas, please.
Good afternoon, sir. Sir, with all humbleness and my regards to you, I share with you one case that we recently treated of a young girl who is 12 years old, and she presented with a stone uh, in the salivary gland. So, because we are all students of Dr. Khan, our all our referencing starts from the organon, and all our prescribing is on the basis of organon. In organon, Hahnemann mentions about the true surgical conditions which occur because of causes without, and all those disease conditions which occur because of a disturbance in the soil, which disturbs our homeostasis, requires prescribing purely from of prescribing of an indicated anti-miasmatic remedy. And these are what we call inappropriately called surgical conditions. So far in our clinical practice, where even if it comes to large stones, large calculi, if the choice of the remedy is correct, then the patient surgery. And we also find sometimes stones in salivary glands, and what we call sialolithiasis. And in my short clinical experience, I have found that with the indicated remedies, these stones also pass out quickly under the effect of the right remedy. So in aphorism 186 of the Organon, Hahnemann defines what are true surgical conditions, and all others which arise because of those dynamic disturbances require a dynamic remedy in the form of a potentized homeopathic preparation. So this young girl was brought to us on 16th of November 2019. She was 12 years old, and over a period of time, that's what the father and the foster mother informed, that over last couple of months, she had gradually started developing a swelling in the left submandibular region. And whenever she used to eat something or drink something, that is when the swelling used to become more pronounced. It was a painless swallowing. There was no pain on swallowing either. The swelling, and when we examined the swelling, it was non-tender. uh, so the parents had taken opinion from the local physician previously, and they gave her some antibiotics, thinking that probably there is enlarged lymph node, which is painless. Some suggested that we should go for FNAC, but eventually one of the doctors recommended her for an ultrasound of the neck, and the ultrasound revealed that there is a small hypoechoic cyst in the right lobe of the thyroid, which suggested a colloid cyst, but otherwise everything was fine. But the girl had a swelling which was on the left side in the submandibular region. So that's when the parents brought the kid to us, and when we examined and went to the history, it seemed like a classic presentation of Sialolithiasis. So we requested for a CECT of the neck, and when the patient came down with a CECT of the neck, then it showed that there were few enlarged lymph nodes in the region of neck. There was mild adenoidal hypertrophy. Both the palatine tonsils were enlarged, and there was an 8 by 4 millimeter calcified focus in the left floor of the mouth, and there were cysts, multiple colloid cysts in both the lobes of the thyroid. That's what the record showed. So the radiologist who was reviewing the film told the parents that this would require surgery, and in some time it's going to be very painful, and it's a small simple procedure by which this can be removed. We must investigate whether these enlarged lymph nodes are because of some underlying tuberculosis like condition, because over a couple of weeks the child's appetite had gone down, the child had also lost some weight. And then he also suggested to the parents that we must investigate the thyroid as well, the thyroid functioning. So, with all this information, the parents came back with the child, and I said, let me examine. Now that we can diagnose, then we can certainly treat as well. So we went through the history. The father of the child was there, and the father had remarried because about 7 years back, the mother had passed away because of some cardiac problem. The father was not quite aware, or we would say that he was not really willing to divulge the circumstances around her death. So we could not really get the intrauterine history. In fact, it is always important, uh, and this is something we have strictly learned from Sir, that wherever possible, your history should be as longitudinal as possible. And in every kid's case, or even of a grown-up person's case, wherever possible, try to ascertain the intrauterine history. And as we found, the father was not really willing to divulge a lot of information, so we could not get the intrauterine history. And the only thing we came to know that the child was always prone to some respiratory troubles. So either there was some episode of cold or sore throat, and usually it was without fever. The other thing that we found in the child, that the child was in the habit of bedwetting uh, till the age of 10 years. The other thing that we found was the child during the early childhood also used to suffer some intertrigo in the middle of the thigh, and sometimes even in the axillary fold there used to be some redness, inflammation, and itching recurrently. uh, the girl was dark eyes, dark haired, and did not really interact with the parents. much, used to speak very softly, and most of the questions that she used to answer was in monosyllables or maybe barely half a sentence, and that's when the answer would be over. So it took us about one and a half hours in the second time, with the report. Even in the first time, we started taking very seriously, but the father was not really cooperative, giving any information. The foster mother was not really aware of too many things about her, and the child was so over the two sessions, which lasted more than an hour each time. The history that we got, besides this past history, is that multiple lipoma, and the paternal grandfather was the diabetic. We saw her in November 2019, so the same year, earlier in the year, somewhere around April, she had had her menarche, and ever since she had delayed cycles, but they were occurring regularly at about 2 or 3 months interval. And so prior to November, so her last cycle was in the last week of September. Uh, Her appetite had gone down over the previous couple of weeks, and she was born and brought up in the NCR region, but her family belonged to Jharkhand. Uh, Her appetite, and she was non-vegetarian in a diet. Her thirst was always low. Over last couple of weeks, she said that, I feel more thirsty and I want to have sips of cold water whenever possible. I do not like normal water, even though my father says you have a sensitive throat, and I always was comfortable with warm water, but now I would prefer having cold water. uh, and we also noticed that throughout the case taking, whenever we used to divert her, she was always rubbing her palms, and the palms were sweaty. So when we inquired from the father and when we observed, that's what we saw, that she tends to get anxious, and that's when she has sweaty palms. She's always slept well, and the father said that ever since he remembers, she always used to sleep with the mouth open. And what the CT scan also showed that she had adenoidal hypertrophy. That explains why she used to sleep with the mouth open. Uh, she has always disliked disliked milk. That's something she always did. So no marked change in that. Her tummy used to clear regularly. Urine was fine. Uh, yeah. Then apart from that, they were always uh, regularly non-vegetarian in diet, but the girl specifically was very fond of mutton, and she said that she can have mutton all 3 meals of the day, and this had become more of a tradition ever since she attained the Minaki. Uh, she also enjoyed chicken, and she was also very fond of paneer, and especially she enjoyed the paneer momos. Mutton in any whether it was grilled or with gravy. Uh, and she enjoyed pickles. She was not very particular about her preferences for the kind of taste, but she would salty, spicy stuff over sweets anytime. Uh, and she generally, the father said that she is very responsible because ever since the mother has died, and she has a younger brother as well. So the father said that, she would go to the office and he would leave things behind with her, and she would manage things very well. When she would leave with the servants, would take care of the younger brother. She is also, father informed, very organized when it comes to her books or a table or her regular curriculum or things in a room. and she is also very giving. She said that he also informed that she had practically taken care of the younger sibling as a mother, and if the father was ever unwell, she would ensure that he gets all that he requires. She attends to all his needs, and he said that over time she had grown up to become lady of the house, and that is until the foster mother arrived. And she also shares a very good equation with the foster mother. And what we saw, that foster mother knew much more or gave much more inputs about the child, having a very cordial, comfortable relationship. um, and generally she was very scared of animals, especially dogs or cats or all kinds of animals. uh, so what stood out in the case was uh, can you hear me? There seems to be some network issue. Okay, so um, what was more marked in the case was uh, the tendency and the sensitivity to cold and cough, the early childhood tendency for the friction in the folds, especially in the groin and the underarm region. Hi, can you hear me properly, all of you?
जी भैया कंटिन्यू
Navia,
कीजिए.
Arkam, can you hear me properly?
It's okay.
Yes, yes, sir. Yes, sir. We hear you.
Continue.
Okay, okay, sorry. So, the history of bedwetting for a long period of time, the tendency for the intertrigo, the sensitivity towards cold and cough, uh, the general sensitive, sympathetic, and responsible nature of the child, the fear of dogs, um the strong craving for meat. The remedy was very obvious, causticum. So I prescribed causticum in ascending LM potency, uh, and so we gave causticum LM1 once a day to the child, and I would especially, though we are all students of Dr. Khan, and we know we study organon regularly, but especially I would like to point out this section in the organon of Porzum 248, where he writes regarding the LM potencies, thus in chronic diseases, every correctly chosen homeopathic medicine, even those whose action is of long duration, may be repeated daily for months with ever-increasing success. So this is the reason why we can give LM potencies and even deep acting remedies, sorinum, cisalinum, medorinum, causticum, which goes into the system, can be cleared in days time, if required, even twice a day, thrice a day, in divided doses. So, and the most interesting part, if you read the footnote to the aphorism 248 in the it says that made in 40, 30, 20, 15, or 8 tablespoons of water with the addition of some alcohol, all a piece of charcoal in order to preserve it. The solution of the medicinal globule. And he writes in parentheses, and it is rarely necessary to use more than one globule. Uh, Now, what happens is that to the government of Delhi, at one point of time, we had an inspection from the head office. And they came and they said that Dr. Gyan, you are one person who has the maximum number of medicines. You order the maximum number of medicines. You want to keep all available potencies that we have in our stock. But whenever we have a visit to your dispensary, it is hardly used. So my pharmacist who was there with us, he said that that's we give only one dose of minimum. So we use all of them, but we don't use too much. So similarly, when it came to the LM potency, they said, why don't you put 18 to 20 globules? And I said, because it is not required to add more than one. And that's what the organon says. So he said, well, in that case, the medicines will never run out. And we have seen in our practice that, even if we give multiple of the centesimal potency, even if you add 20 globules of the LM potency, it does not really aggravate the patient. So I was quiet. I did not reply anything to them because they were my seniors. But what I do know is that if the more similar the remedy, the more minimum stimulus you require. And when you look at this footnote in the aphorism of organon, it says that this is more than enough. And that's why Haman makes it very clear. It is rarely necessary to use more than one globule. And same way in this footnote, he also goes on to explain how we can further dilute in sensitive patients. We can go to the second cup or the third cup, as Sir has explained and taught us very clearly in the practice. Uh, so now let me refer to the Allen's keynotes. Uh, so in the first line of the Allen's keynotes, he writes in causticum, adapted to persons with dark hair and rigid fiber, subject to affections of respiratory and tracts, children with dark hair and eyes, delicate, sensitive, skin prone to intertrigo during dentition. And we all know that causticum is an extremely sympathetic remedy in our materia medica and has a very strong craving for meat. So this was the reason why we prescribed causticum. And now when we followed up, then we found that the did not change for the next couple of weeks, but we continued on the ascending LM potencies. Uh, the other important thing that we found that the sensitivity to cold and cough went down, and somewhere in the month of January is when we received a call from the parents one day, and they said that that she's having a lot of pain in the floor of the mouth, and the swelling has become more pronounced. So that's when we said that okay, what you have to do now is that you have to divide the medicine into multiple doses. So you put 1 teaspoon of in a of water and give it to her and divide it 1 spoonful every 15 minutes, 30 minutes, 45 minutes as required. And let me know in about 3 hours. And just 2 hours later, stood up and they sent me a photo of almost a 1 centimeter big stone. She seems to have passed out something from the mouth, and now the swelling has gone. So, just in a span of about 2 months is when she passed out the stone, which is less than 2 months actually. And in the month of February is when we repeated the scan for her. And the MRI scan, next we repeated in the month of February an MRI of the neck. So what we found that the adenoids were still large, the lymph nodes had gone down, the colloidal cysts in the thyroid gland had disappeared. The still enlarged, what the duct, but otherwise there was no calcification. The palatine tonsils had gone down. Uh, yeah, so she's still continuing on the ascending LM potencies of causticum. Um, and in fact, now causticum is one of the remedies which is also a part of the chronic diseases. It is an anti-miasmatic drug, and what we do find in chronic diseases that you do find the swelling of the submandibular gland or swelling and enlargement in the neck also in the proving records. So the entire totality was covered by and it has been one of the quickest responses to sialolithiasis. Um, yeah, that's all that I wanted to share in my small experience with this today. Thank you so much. Thank you, sir. Sir,
Did you like to say?
sir, this is the clinical experience I wanted to share.